Hi guys, Victoria here. Thanks for tuning in. Please subscribe. Please have a look at this series. So this is the latest therapies series of mine. There's all sorts on here, from core therapy to Indian head massage, foot reflexology, and also aromatherapy massage. Today I show you Khamsin's core therapy treatment. Beautiful Khamsin is 35 weeks pregnant. Now, as a therapist, and all therapists watching this now will know, you have to be really careful with all stages of pregnancy. Khamsin is, as I say, 35 weeks, so this might be the last time I'll be treating her with core before she has her baby. This will be her third treatment, and she had come to me in a severe amount of pain and a lack of mobility. She's already moving better, so I talked to her at the beginning to see how she's feeling after the first two treatments, and then we move forward. So thanks for tuning in, thanks for subscribing, please like, comment, share, and I'll see you soon. Okay, so Khamsin, you're here for another treatment?
Yes.
You're having core today?
Yeah.
And you're beautifully pregnant?
Yes.
How many weeks are we?
35.
35, and how are you feeling?
Tired and hot.
Yeah, it's a very hot day.
I'm okay.
Yeah. So this is your third
treatment
of these treatments, and what did you originally start coming for?
A lot of pain down my right side mainly, but down the sort of the sides of my pelvis, to the point that I was sort of struggling to roll over in bed and walk around and really do anything. Yeah.
Okay.
So general pregnancy pain, but also that sort of specific.
Yes. And as I said to you at the time, I do have to be very careful with core therapy, with some of the techniques that I use with advanced pregnancy. Yeah. But I think we've managed it. Yeah. Is that right? Is it feeling better?
I'm feeling so much better already. To the point that I'm walking around with
you don't need to be here. Is that why you're here?
Yeah, it's really helped.
Oh, wonderful. You look like relieved.
I feel
and
so much better, and
yeah.
my family are saying like you're so much more relaxed and happier. A lot less miserable than I was.
Warms my heart. That's why I'm in this profession. Fantastic. Okay, so let's give you a nice lovely treatment.
Let's go for it.
Core therapy is the coming together of the neurological system, the nerves, and the immune system, whereby one talks to the other and the body is neurologically organised, which means that the brain knows exactly where needs to be healed and can get on with sending messages to that area, clearing the pathways of immune and blood circulation in order to channel energy and healing to that area. So here I am treating beautiful Khamsin, 35 weeks pregnant, to a core therapy treatment. First of all, in any core therapy, a therapist will take kinesiology tests to find out exactly where any systemic and foundational issues may lie. So, for instance, if I was to ask you, or even myself, where exactly is the root of any problems that I may be suffering symptoms with at the moment, our brains and our minds would probably not be able to answer that question. Whereas kinesiology will ask the subconscious exactly where needs to be treated, repatterned, realigned, in order to bring correct balance to the body, that it is aligned in the best possible structure for good health. So here I am explaining to Khamsin that one side of her body, which is in kinesiology terms called an IPSI test, IPSI, which means one-sided. And maybe because of where the baby's lying, maybe because of some repetitive action that she's doing just on one side of her body, for instance, sweeping, hoovering, raking, etc. All of these actions are not good for sending the pelvis and the spine twisted and off in one direction. Having found a right-sided IPSI failed test, I then anchor it and therapy localise it to make sure that it then passes, which it did. I then move on and check her contralateral test, which is the arm on one side, the leg on the opposite side. And both of those this week were strong, which is excellent. The previous week when she came for a treatment, she'd been in pain. And I noticed, even though she hadn't had pain in her jaw, that the TMJ, which is called the temporomandibular joint, was slightly out of alignment, causing both contralateral tests to fail. I had given the jaw some therapy, which apparently she now tells me that it felt amazing at the time, but definitely afterwards, when she left the treatment room and for the next few days, she explained to me that her jaw felt like it was longer and relaxed, that it had descended. It wasn't gripping so tightly anymore. This also helps our sleep, which at the moment, and don't we all, we need our sleep, but with 35 weeks pregnant, she definitely needs her sleep ready for baby coming. So now I'm doing a test called a psoas test. The psoas muscles are found in the pelvis, and this test, which takes the foot out and up slightly, and I try and push downwards, as you can see. Both sides aren't as strong as they should be. There is some give there. And in order to find the reason for that, I go to the neck. So the very top vertebra, called the atlas, is C1. And that vertebra looks different to the rest of the vertebrae in the spine. It looks like a sliver of a bone. It's quite fine and thin. And it can get caught up in the base of the back of the cranium, which is called the occiput bone, especially with poor neck posture, repetitive action of neck downwards, or even with whiplash. So I therapy localised it and then retested that psoas muscle on both sides, and it went strong, which confirms for me, for Khamsin, but more importantly for Khamsin's neurological system, her brain, that between us we had found the reason for that failure. And by therapy localising it, it adds to the list that needs to be treated during the second part of the treatment. At the moment we're doing the first part, which is the kinesiology muscle tests. So this is called a ballet test. I'm checking to see if both of her hips are happy opening. So now I'm testing the left hip in 3 places to see if the left hip is happy opening to a small, medium or larger extent. Now when she came to me, Khamsin's right hip was particularly sore, and she found it very difficult even to hold those postures, let alone then hold a muscle test. So once Khamsin has rolled onto her side, I am able to get her comfortable, plenty of cushions. She makes sure that her tummy is well supported, her hips are well aligned, and of course her neck. Really important, as you can see there, that the pillow is pulled right down to the shoulder. I'm asking her to hold her little finger and thumb together, and this is another muscle test where I'm using her little finger and thumb as an SIM, a strong indicator muscle. And now I'm checking all the points of her sacrum just to see if any point is out of balance. Of course, this is where most of the pain will be coming from, that then she then feels into the side of her hip, normally her right at the moment, and down her right leg. As you could see from the chat at the start, she's in far reduced pain, which is wonderful. It's music to a therapist's ears to hear that the actions that they are taking are making good repatterning, good effects to the body, causing no or little pain. So now I'm doing Tuina, that you may well have seen on some of the other core therapy posts that I have shared with you over the last few weeks. And Khamsin being pregnant, she's simply lying on her side, just slightly over, so that she's not putting any pressure on baby. And I'm using both of my hands, normally one hand in a supportive position and the other hand applying a little bit of pressure. It's not too much, because when we have pregnant clients at any stage of their pregnancy, we ensure that we're not doing anything that will affect the pelvis, i.e. the position of baby. We want to make sure baby is happy and not affected by repatterning of the spinal pelvis, and can only be improved that the blood, the oxygen, and especially the blood to the placenta is not constricted in any way. So I am using one hand just to support her hip, while I'm using the other by pushing with my thenar muscle at the base of the thumb gently down on the sides of the spine. So I'm pushing down towards the floor, and she's telling me here that it feels really good, that she had felt quite strained, tight, lots of tension, especially between the scapula, the shoulder blades, and around the sacrum. I'm not doing too much around the sacrum because of the position of baby and the number of weeks that Khamsin is pregnant at the moment. This is Khamsin's third treatment. The first two were able to very gently test and then treat in a reduced area compared to today's treatment. And as in most of therapy, less is more. So quite often we will give less essential oil, less pressure, less time in a particular area than we would normally do, in order to give intention and compassion instead of applying too much. So she's really enjoying this now, and I'm shortly able to work a little bit on the hips. I can see that there is some movement there. I'm always asking Khamsin how she feels generally, but also in the area that I'm working. So So I'm working now on the side of the sacrum and on the top and over the top of the iliac, which is the hip bone. Most of the intention I'm giving here is energy and qigong rather than pressure and movement. You can see there's a little movement there, which is creating a small rocking mechanism. This is a feeling that does send us back in our minds to the cradle, that wonderful feeling of being nurtured and cared for. So this Tuina Chinese massage generally does make us feel connected to those early years of being cared for, the compassion and the nurture that we had as infants. And our subconscious will be welcoming that with open arms. In fact, anyone who does yoga, you'll know that many yoga moves not only are symmetrical, whatever we carry out on one side will repeat on the other side, but quite often will rock from one side to another. And that is such a lovely technique to introduce to our own bodies, where that rocking feeling, without us really acknowledging, noticing it at the time, will connect us back to ourselves as infants, feeling as if we're in our mother's arms, and indeed our father's arms, being loved and cared for. I'm now using both of my palms in an overlapping gesture on her sacrum. Normally we would give maybe 5, 10, 15 minutes of treatment, but with Khamsin being heavily pregnant, I'm just warming and giving intentional healing energy to the sacrum and to the right hip. I'm now working around the scapula, the deltoid, top of the shoulder, the upper back, and into the thoracics to make sure that the shoulder is flexible and loose. It's not strained and gripping onto the spine at that upper level. You can see some movement there, so that's good. It's not caught. And again, that rocking movement is just so therapeutic and nurturing. I can tell from the feel under my hands that Khamsin is deeply relaxed. So I now ask Khamsin to turn over when I'll be repeating all of those beautiful Tuina actions to her left side, making sure that the pillows are supporting and creating the correct alignment in spine, neck and pelvis. Now moving on, while she's on her back, to a wonderful check of her hips, her shoulders, her knees, her whole length alignment, where I'm just tuning into the ankles and the feet to make sure that there is no inconsistency one side to the other. I'm using my thumbs down her spine, which is the inside length of each foot. So I'm managing to show you here a little bit of close-up work on what I'm doing with Khamsin's feet. So I'm working up and down the length of the spine. This is the area for Khamsin that had been caught and tight, full of tension. And quite often when we get tension there, it's really difficult to let go of. So if we're able to work directly on the area, as I did with the Tuina, but also via the feet with these reflexology moves, then it's a two-pronged attack and we can achieve far greater relief from stress and from tension. This is the neck area. Now the lungs and round to the shoulder. Now I'm using 2 or 3 fingers on the joints on the right hand side, and again the same on the left foot, working up the spine to the head. I'm making sure that I'm not covering any of the hormonal and reproductive areas, for instance the ovaries, uterus, fallopian tubes, nor the pituitary. A nice pressure, but also while I'm doing this, it stretches the whole spine out, working round the back of the left side of the neck. Giving it a really good check and a stretch. Working into the left lung, into the left shoulder, so beautiful to receive. You can actually feel it working directly into the shoulder while working on the foot. And now those joints on the left side, the hip, the knee and the elbow. So thank you for joining me. Tune in next time to see Khamsin's cranial balancing treatment, followed by regular posts every Monday and Friday.